Dr. Collins, a major healthcare system in the state of Maine, has contacted me to express concern about the equipment that they may need to store the vaccine safely. They have already bought additional refrigeration units in order to store the flu vaccine, and they are stocking up on that. But at least some of the vaccine presentations that are under study would require a sub-zero refrigeration. That's expensive, particularly for rural hospitals in a state like Maine that are already struggling financially. If we're going to ensure that there is access to the groups that I mentioned with Dr. Adams, how can we do so? How can we ensure that we're not creating inequities and uneven access unless we're helping with the purchase of those very expensive refrigeration units?
It's a great question, Senator. And I think there's an intense effort underway right now to figure out how best to address this. And certainly the Surgeon General and I have been engaged in some of those discussions. This is an Operation Warp Speed component that is being done in a way that's never really been done before, to try to imagine how to do the distribution when we aren't even quite sure yet which vaccines are going to end up being the ones to distribute. You are right that one of the vaccines, the one that's being produced by Pfizer, requires storage at minus 70 degrees Celsius, which is, I think, minus 94 Fahrenheit or some really low number. And that is a challenge for a lot of refrigeration situations. But I think Warp Speed is totally in the space here of trying to figure out with CDC how to make sure that that doesn't become a deterrent to distribution. If that turns out to be the vaccine that Maine needs, then we want to be sure that's the vaccine that Maine can get. And that includes in rural areas, not just in the big cities. So intense attention. I have to say, I've been very impressed. General Perna, who is leading this part of the effort for Operation Warp Speed, is a guy who knows how to do supply chain. And that's what we're going to be all about here. And that's being intensively pursued.